everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, please let us know. I'm Dr. Emily King.
I'm Courtney Allen.
I'm Devin Fortune.
I'm Dr. Ashland Duckwall.
And this is the Veterinary Roundtable.
There we go. Good job. That sounded really good.
Whoop,
Okay,
whoop.
excellent.
The accent.
Welcome
Why
back.
do we always add an accent?
It just adds to it.
I wonder if people think we have accents.
Because we're in Indiana.
Yeah.
We do. Really? Well, like,
We should ask someone like
Well-
Dr. Danielle.
Yeah.
Dr. Danielle.
isn't English
last
one
name?
of like the
Conway.
Yes, Conway. Go
Isn't
ahead.
English one of like the hardest languages and accents to learn
Yes.
when you're not from here?
Yes.
Do we have an accent though? Is what I want to
Well,
know.
everyone have an accent.
Can someone that does
I
not
don't
live in
know.
Indiana or the Midwest tell us
Comment.
if we have?
Leave a review and
accents
tell
to
us
you.
if we sound
Because
funny.
those reviews
Yeah.
really crank it up there.
Segway.
So yeah, way to go, people, for leaving all
Yeah.
these reviews. Oh my gosh.
Thank you. Thank you. Thank you.
They
It
help
was-
boost us in the algorithm.
Algorithm.
We are 189 from 185
Whoop, whoop.
on Spotify.
Oh no, we didn't get any new
It's okay.
Apple.
No Apple.
Apple.
Devin can take a sigh of relief.
Yes, I can sleep
Another
peacefully
week.
one more
She
day.
is 33 away from the milk mile. I don't know.
Wow.
Okay,
what's
we
it.
have not determined that.
That really doesn't.
I
sound
have
like
a
that
mom,
lot.
a dad, a brother, an uncle.
What?
Yeah,
I'm gonna
where
have
are
all
the
of them leave
33
reviews.
people out there in
No.
the hiding in the woods?
That's right. That's right.
I really thought Apple was the biggest platform, but I guess Spotify is. I did not know
I
that.
don't have Apple like music and podcasts.
Yeah, I know that. I just think, well, because
Is it
most
'cause
people have
Spotify's
iPhones, I feel
Free
like.
and Apple, you have to pay.
But
That
aren't,
is
well,
true.
isn't the podcast app free though?
on Apple.
Yeah, like
I
it
don't
comes
think
with the iPhone.
Right.
Oh, yeah.
And our podcast is
So
that's
those
what- I don't know.
Android people
I used that
are
once
using
for
Spotify.
the episode she made with Dr. Crocker
Oh,
in Vegas.
yeah, I don't
But-
know. I just thought Apple was more.
Spotify just has ads. I don't know if Apple Podcasts or music has ads.
Someone tell us.
Isn't that
Well, that's
interesting?
dumb.
Don't know why.
We should repeat that.
So
what did
yeah,
Harrison
go ahead,
say?
say
She said that Apple Podcasts and music is more popular, but people are more inclined to leave reviews on Spotify.
I wonder if it's easier to leave the review, and so then
Hmm.
that's why they do it.
Leave us a review and let us know.
Okay.
Jacob said it was really hard to leave a review on Apple. He couldn't figure it out, so
yeah.
maybe
So
it
see,
is.
maybe it is harder. So hey, also don't forget check out the Instagram channel for the Veterinary
Yes.
Roundtable
Mhm.
and the TikTok page at the Veterinary Roundtable.
Also, we were talking. We want to know like what people want.
Veterinary Roundtable? Yes. Sorry.
We want to know what people want to see on our social media. Like, do you care about our clips that are on the page when you go to it? Do you want more of our stories that we're posting with our personal, funny, weird stuff that happens? Seriously, we were just
Yeah.
talking about it
Mhm.
yesterday. And we were like, we don't know what the people want.
Yes.
Yeah.
We
Let
need
us know what you
ideas.
want to see because
Yes.
we're
And
more
if
than
you don't
happy
care
to
and you
give
just want
you.
to listen to us, that's fine too.
Mhm.
And that's fine.
Yeah, it's fine.
Absolutely.
Yes.
No shame. No shame in the game.
Okay.
All right. We're on to trending topics.
Icebreakers.
You want?
Oh, did you want to do your icebreaker?
Oh, you want to do it right now? Sure.
Or you can do it later.
We're going to do some fun icebreakers. One moment. Let me pull up from the Google.
From the
Okay.
Googles.
These are just random.
Okay.
So, whatever.
All right. Ask
Would you
away.
rather have hands for feet or feet for hands?
Definitely hands for feet.
Totally hands for feet.
Hands for
Think
feet.
about how much you can grab.
Yeah, think of the orangutan. Can do everything with
Yep.
4
Yeah.
limbs.
we would be that would yeah, but like how would you do that? Would you just sit like wheel yourself around on a wheelie chair all the time so you could use your feet because
Well,
you have to walk?
Or you could use one and hop on the other.
Yeah.
That's what I would
My
do.
neighbor, when we were growing up, we would play Barbies all the time. And she used her feet to like hold the Barbies. Like her feet are
wow.
literally like hands. She can use her toes like fingers.
It's impressive.
Oh my gosh.
But I don't know. Yeah, hands for feet.
Because then if you
Hands.
had feet for
Yeah.
hands,
You
then
couldn't
you'd have
do
to,
What do you
anything.
do? You're a dog.
That's so gross.
You're essentially a dog.
You can do anything.
Okay, so we all agree unanimously.
Yes.
Hands for feet.
Mhm.
Absolutely.
Dumb question, Ashlyn. Okay. Let's see. Would you rather have a dinosaur as a pet or a tiger? That one's kind of boring.
Yeah.
Okay, let's.
Well, I was thinking about it.
Oh, okay.
I
well,
don't know what I would say though.
I don't know. Have you seen those like videos on social media where like a kid is sitting in front of the glass at a zoo and a tiger is sneaking up behind it and goes after the glass?
Did you see that video of that
Scary.
that mauling? And I forget where it was, but a couple months ago,
With the dinosaur?
Yes, actually,
No.
yes, I did see
No,
that.
with a lion. No, I think it was a tiger. Someone got into the
Yes.
exhibit and it was like a big like drop.
Yep.
Yeah.
And they couldn't
Oh,
get back
yeah.
out. And
Yeah.
Yep.
Well,
whole
don't get
thing
that close
is
to
on
the
video.
That's natural selection.
I-
Don't get that close to the railing.
I don't know.
yeah,
They're
that's
both dangerous. I really like dinosaurs, but I really like cats.
But what kind of dinosaur?
The ones that can fly.
A
I'd like to have one of those.
velociraptor?
Ooh.
Sure.
No, I like the brachiosauruses, the ones with the long necks. And
Oh,
like
those are
lots of
cute.
swoopy-
And they're
Oh, and they're vegetarians,
herbivores.
so then we don't have to
Yeah.
worry about getting eaten.
Have you seen Land Before Time? Please tell me you
Yes.
know what Land Before Time is.
No, she's
Devin.
not going to know Land.
She has been showing her age recently, like big time.
Yeah.
We should
No
have
way.
a movie night and watch
Stop
Land
asking me
Before
this
Time.
question.
Yeah,
Oh my gosh.
She only knows
well,
Oswald.
Oswald was my stuff.
Is that
This
all
is
you
a
got?
good one. No, I'll do one more and then
Okay.
we can be
Do
done.
you guys know what Oswald is? Oswald the octopus?
No.
No, we talked about this last time.
We did?
Actually, we talked about Land Before Time and then we talked about Oswald and how we didn't know.
Did we?
I'm pretty sure.
Yes.
I don't
There's
remember
a
that at all.
transition of age there.
There we go. Yep.
Okay, would you rather eat only pickles for a week or drink only soy sauce for a week?
Oh,
I
Pickles.
love soy sauce. Well, but I'm also Asian.
So much sodium.
I
and
talking
both
about
the
pickles?
choices.
That's
pickles is
true.
straight
Pickles
salt.
and
But
It's a good
pickles.
point.
Wait, so what? Drink soy sauce or eat pickles?
Yep, for a week.
Can you eat nothing
Nope,
else?
that's it. That's it.
I'm totally going pickles.
Pickles.
You're
I
gonna
really
get
like soy
dehydrated
sauce
so
so quickly.
But like, I want to be able to like chew on something.
Can it be like any type of pickle?
Sure.
Like dill, bread and
Whatever you
butter.
want. Yeah.
Okay. Pickle.
I'm
Pickle.
definitely
I'm
doing pickles.
I
conflicted.
mean, they're basically just
I
cucumbers.
really like soy sauce.
Who says you can't dehydrate the pickle? No, it didn't say that in there. You just dry it out.
Dry it out.
and-
Well, then you're getting dehydrated either way.
Are you though?
Because
I think it would be very bad for you
it's
if you drink
either
either
an
one.
excessive amount of sodium or a
Pickle?
freeze-dried pickle.
You can't suck the sodium
And
out of
no
the pickle though.
moisture.
You're still gonna get a lot of sodium either way.
just with less moisture.
I don't know.
Can you drink
I don't
water
know.
simultaneously?
I'm just saying
stay
what the
alive.
question is. Okay. Well, there you go.
Okay.
Until next time.
Until next time. There. Yep.
Would you say pickle?
Yeah, pickle.
Okay.
Oh, wait, I have one more note to add. If you chose pickle, you could have fried pickles. You could have,
Mhm.
and that's all I got. But, you know,
Uh-huh.
But
Mini
just the
pickles, big
Yeah.
pickles.
there's a variety.
No
Spears
ranch,
of
though.
pickles, sliced pickles,
Yeah. Chips.
chips.
I went ham on pickles when I was pregnant. It
Oh,
was
I love
the-
ham on pickles.
Oh
No.
yeah. No,
Ham?
no, not actual ham. I went ham. Like I
Oh,
went crazy for
I love ham on pickles.
Ham on pickles is really good. And
It
then,
does sound great though.
and then you put a piece of cheese, like cute
Yes.
cheddar cheese.
You wrap
ham,
it up like a
pickle.
taco.
and then
mayo.
you put it in
Mayo.
between bread and,
and then
you
you
have a
eat it.
sandwich.
Maybe that's what I'm going to serve at the doctor
And
get together on
mayo.
Saturday
Okay.
instead of wings. Pickles with ham and cheddar cheese.
I'll be honest, the wings sound a little bit better.
Okay, I'll make the wings.
Okay, great.
Off
can make the
topic,
pickles, too.
but we never talked about Justin Bieber expecting a
pregnant?
child.
Being pregnant,
yeah.
and it's not my kid.
I keep meaning to ask you how you feel about it. But his wife, Hailey Bieber, her craving right now is sorry. What if she watches this?
I could care less.
If she watches this, then we are big time.
It is egg.
What up, Haley?
Her current craving is egg salad on a pickle with hot sauce.
That sounds
Interesting.
That sounds so
Delicious.
good.
I would.
That
should
sounds
try
so
it.
good.
I don't know. Egg salad was always a thing you thought your grandparents ate.
I love egg
They,
salad.
yeah, because it's easy to do.
You
don't have
push it
any
on the
teeth
roof of your
left.
mouth.
Oh my god. Okay.
It's like when Helen eats down, she just grinds it with her
Grinds
gums.
it. Oh my
And her four
gosh,
teeth.
that's too funny. Holy cow.
Mm.
Okay.
Okay, so
Oh,
let's
no.
move on. Trending veterinary
Oh, I'm a-
topics. We're revisiting the FIP. So
Wah, wah, wah.
we were very excited to announce that Stokes was working and going to have this liquid, this GP dash blah blah blah.
Yes.
Right.
Liquid available.
hmm
Well, FDA came out with an article just giving their stance.
Yes.
Yeah.
So basically, they're saying, hey, now it's still not technically legal
Right.
to prescribe it and everything. So, but they're not going to necessarily stop it from happening.
Right.
So it's like a win-lose, win-win.
It's a weird,
Well,
it's a
it's totally a
sticky
win
situation.
because-
Yeah,
Cool.
because you could still use it.
Right. Because they came out with previously in their industry use, basically, like for lack of a better word, handout. They basically, that's outlined in there because there's not an approved FDA drug for treating FIP. Then they don't basically go out and say you can't do this anymore. So really what they wanted to do, right, Duckwall, is they didn't want the bulk drugs, like drugs to be bulk compounded, to be used in offices or other purposes. I think
the technical...
And so then they said, hey, you have to have a nomination to be able to... for us to approve that now you can take metronidazole, make it into a bulk, take that bulk substance, make it into a compounded substances and dispense it. So like they have, I don't know how many are there now, 5 or 6 or 7. Maybe there's more than that now that have been nominated and been approved. But the FIP drug isn't one of them.
Right.
So then that's why they're saying, okay, it's unapproved. But hey, hold on. Don't freak out. Just because it's not approved and therefore not legal doesn't mean that you can't do it.
Yes.
I mean, eventually it's gonna happen.
I would think.
I think maybe too. I think isn't the technical rule like if there is an approved market option, you're supposed to use that.
Right.
So like there's the human antiviral ones, the starts with an R that we talked about last time.
Remdesivir.
Remdesivir. Yeah. So technically, you're supposed to be doing that. Right?
Yes, but it's not approved in animals.
That's right. Yeah.
So like we don't have a treatment for FIP in animals. So because we do not have an FDA approved drug, we can do this.
Gotcha. Makes sense.
So
it's still there.
Okay.
Still there. But I mean, I think it's going to be easier for people to get it.
I wonder if it'll be
because
less
you have
expensive.
somebody in the United States doing it.
People are still doing it anyway. So
So
there you have it.
Alrighty.
Pits and peaks. What you guys got?
I don't have much this week.
No?
I don't either.
No pits or
it's
peaks.
just kind of been like
it's just been like a steady.
I mean, I dug some up.
You dug some up.
I don't really have anything, but
Oh,
okay.
gosh.
I guess
Yeah,
we'll
you go.
It's
yeah,
kind
go
of
for it.
it's
If
kind
you-
of vet med related, but peak is I brought my cat in for blood work today, and I tried the new product Boncat, which we talked about a couple weeks ago, and I think it worked pretty well. We were talking about because Dr. Duckwall tried it on her cat as well, and they were still like not growly, but like vocal and putting up a little bit of a fight, packing them up for the vet. But after we got the blood on my cat, he actually just like curled up in a ball in his blanket in his cage and slept the rest of the day. And then when we got home, he just like went straight back to normal life, which is not normal for him. So I think it really helped him have a better experience.
That's good.
And that helps me have a better experience because it wasn't as
Yeah.
stressful. The pit is that my other cat, Walter, is a turd. And whenever Sid comes home from the vet, he smells the vet on him, and Walter despises the vet. Like, we have to drug him to sedate him at the vet. And so he came up to Sid, sniffed him, and immediately hissing, growling, the whole shebang.
Right.
So I locked him in his room and I drugged him, and I'm just going to let him sleep it out. And then maybe when I get home from this, he'll like be a little loopy and like better.
Chill. Yeah.
I'm like, Walter,
God,
dude,
Walter.
get it
It's
together.
that colony scent. They
He's in-
smell it on.
He's in timeout.
He smells it on Sid, and he says, "Where have you been?
Mhm.
How
I don't-
dare you?"
I don't punish Walter a lot. Courtney knows that. So like for me to punish him, it's a big deal.
Yeah.
So that's my
He'll
pick.
get over it.
My child misbehaving.
Yep.
I will say, speaking on Boncat, I'm gonna try it again on a different cat of mine. I've got many options, so just because Paul's my cat, he's not bad at the
No.
clinic. Like, he's actually one of those chill cats. Like, he's nervous and he'll sit there, but you can do whatever you need to on him. A little wiggly, I guess, for the blood work, but he was just still very vocal in the car ride, and obviously, like most cats, hates the carrier, so scratched me up to get in there and things like that. And then still vocal on the ride home. So I know we were talking before the podcast, so the goal is not to like make them super sedate, and
Right.
you know, we don't want them walking ataxic or super, super doped up. So I'll be interested to see. I'm going to try it on my other cat, who's also chill though. So I don't know.
Yeah.
I'll let you know.
I'll try it on Walter this fall, and I'll let you know.
That's
Yeah.
the real test.
Yeah, it's going to be probably more telling on
Sorry.
those cats who are notably like very stressed,
Yeah.
very, you know, all of the things, hissy, growly, bitey at the vet. So
I think that it's definitely on the label. It says not for sedation, so you're not
Yeah.
going to see any sedation.
Yeah,
I
he
mean,
was still very alert.
they would.
Yeah.
I would say that it is not. It's not sedation.
Mhm.
Like,
Yeah.
I don't know.
Yeah.
I'm going to do. I was telling Doug, I'm going to do in a webinar next week on it, like first use, kind of like they teach you some
Yeah.
different things. So I'll report back
Yes,
Yeah,
I'd
let
love
us
to
know.
know. Yes.
after I hear some.
We
of the
followed the
information.
label instructions. So
Yeah.
unless there's going to be new caveats, we start to learn like
Uh-huh.
still do it the day before or something like that. I don't
Because
know,
it just
but-
says like an hour and a half prior to
Yeah.
the anxiety.
But you can't do
inducing
2
event.
consecutive days. So maybe those cats are a little bit more spicy. You do
Mhm.
it the 2 days. I don't
Mhm.
know. I don't know.
Yeah, I'm just like scared with Walter to try it and have it not work, and then like
Sure.
that's an awful experience, then have to redo it all. So we'll see.
I will say it went down the hatch pretty easy. There was no like
Mhm.
foaming of the mouth, no
Mhm.
vomiting
That's
or anything
encouraging.
like
Oh,
that.
good.
I know. I tried to smell it, and I couldn't make out any scent or anything.
smell it
I know. I was like,
Whereas,
nah.
the gabapentin, it's very
Oh,
it's
yeah.
bad.
Liquid
Yeah.
GABA smells so bad.
Mm.
And Walter always tries to vomit it up.
So maybe that's another perk. So
Yeah, definitely.
all right. My peak was I cleaned my house this afternoon, so I was able to sweep kitchen and all, but I even got the mop out. That's when you know
Ooh.
it's real.
Oh, yeah.
So I got the mop out. I had some time just to clean house. The pit is that my back hurts from doing it. So I'm getting old. My back hurts
Can't
after
even
riding
clean
my
your
horse
house.
when I sweep a lot, mop.
Oh gosh.
Yeah.
So what you're saying is you probably should maybe start working out to like strengthen everything?
Yeah, probably the
We can work
core,
out
which is
together.
I also feel like
good.
there's ways that you can ride Wayne without it hurting that much.
Probably. I post trot.
She
which is-
posts in a Western saddle.
Okay,
which,
no,
if you know
before
anything
all
about
the haters come after me, it's because I learned how, and he's too bumpy. He doesn't have a smooth sit trot.
Are your stirrups shorter then? Like,
No.
are they short
Oh,
enough for you
no.
to post?
Is it
No,
speaking
they're at the-
Spanish to you?
No, they're a little bit longer because the Western
Yeah.
seat you sit back and chill.
But it's so.
Come on out and watch me ride. It looks like I feel like I'm going,
I don't even- I don't
decently
even know how
fast, and then I watch videos
You're
and
like,
it's like
that's
he's
so
just
slow.
putzing
I
along.
don't even know how you do that. It's impressive.
Oh my gosh.
He's just getting on the back. It's just fun.
It's
I
like
could just
those
walk
videos
around.
that you see, or the picture you see of this is what I feel I look like when I'm working out. And
Yes.
It's like some like amazing picture.
Yeah.
And you're like, no, this is not me when
Yeah.
I'm working out.
Yeah.
Oh gosh.
Okay. Who's up next?
Who-
Kingling?
anybody else have any pits? or peaks?
Yeah, I just came up with some on the
Okay.
spot. I'll start with my pet. My little Mijo baby, my Miles, my dog, is hurt.
Oh no.
Does he still have his tippies on?
It's very minor.
You know, it's not
He's
anything
fine.
big. It's nothing big by any means.
his hurts.
He's my kid. And like he has this injury. It's a dumb injury. He just has like pressure sores pretty much on the inside of his toes on his back paws. But like it's annoying because he has to be rested and we like doing stuff with him.
Oh.
So like
it's, like, very
it puts
annoying,
It puts a
the
damper
nail.
on our week.
Yeah.
Because we like when Jacob and I, my husband and I get home from work, like we really look forward to going on a walk with Miles or take him to the park. And like, so this week we had to rest him, which it is what it is, but it just puts a damper on the week,
Yeah.
you know?
Yeah.
It's kind of sad because he does everything with us. So,
Does he still have his bandages?
nope.
No. He had some really cute bandages on.
Yeah, he had yellow vet wrap going all the way up his back legs.
Yellow
He had
high
rain
heels.
boots on.
It's like the most awkward spot. It's like his nail and the way he plants his feet and plays
Yeah.
and stuff.
Huh.
It's like literally creating this pressure sore.
Yeah.
Yeah.
but it's new.
Interesting.
Like it just started.
Yeah.
It's never, and his feet didn't change.
Yeah.
It could have been the substrate maybe he was running on.
Yeah,
or
we
something.
took him to my in-laws on Sunday, and they live like in the woods. But he's been there before,
Yeah.
so I don't know. It is what it is. It just sucks.
Poor guy.
Yeah. But my peak is that. So Sunday is technically this week, right? Mother's Day.
Oh.
We split the day because this is my first year. Like, I mean, I've always celebrated my mother-in-law, but she's officially my mother-in-law this year, so I just thought it was really special. And we hung out
Aw.
with her half the day, and then we went to my parents half the day. But like, we planted her tomatoes, and so it was just really fun
That's
having
sweet.
like a second mom officially to celebrate. You know,
Yeah.
That's
Aw.
it
very
felt
cool.
special
That's
this
very
year.
sweet.
That's
Yeah.
really cool.
I love her
Awesome.
though. Love my mother-in-law. She's the best.
I would say my peak was same thing. Mother's Day. We all, because the weather here in Indiana was really awesome.
Perfect.
So we were all outside. Everybody came into the house. We just all hung out, visited.
Mhm.
Super easy, like chill day.
Yeah.
You know, so
was
all
so
my sisters
nice.
came
It
over, and
was
then my
really
mom
nice.
came over, and so
That's
It
awesome.
was
That was
so
really
nice
good.
outside.
yeah. I would say my pit was the concept of casting out nines in multiplication and division.
It's always like teacher related.
I really like this as a way of checking math and knowing whether or not your answer is correct. Calvin does not.
Yeah.
But
Calvin doesn't seem to like much math.
on a side note, he did get it and understand it.
Did he?
He did the whole. He did.
You do it so well.
So,
She literally
yeah.
nails it. It's like
Yeah.
Calvin is sitting right there.
Yep. So yeah, that was it. Was a pit turned into a peak, but his chapter 2 test is tomorrow. So
Oh dear.
Mm.
I
Let us
will-
know.
yeah, update everybody.
Best of luck, Calvin.
next week.
I believe in
So,
you.
Yep.
Okay, listener icebreakers.
Okay. So first one is, can you talk about any tips and advice for people wanting to go into vet school? And can you also explain if it would be better to be a vet instead of a vet tech? I can't decide if I should just go all the way and be a vet. Nicole
Palusha.
Palusha.
Yeah.
Really
That's how
sorry.
I pronounce
Sorry,
it.
Nicole. I mean, that's a valid question. I don't know if we really can answer it straight up because it's different for everybody.
Yeah, I would say it's different for everybody. I think the main difference is do you want like responsibility on your shoulders for like decision making?
Yeah.
Like from the standpoint of
Diagnosing and-
diagnosing and then decision making.
Yeah.
Well, even
Yeah.
things that are done, ultimately it falls on you. Like if there's a misunderstanding, a mistake, if
Sure.
there's a,
The buck stops with you.
yes.
It's a bigger leadership role.
Mhm.
Yeah.
You have more, not more responsibility, but kind of more responsibility.
Yeah.
Yeah. Yeah.
I agree.
So I don't think there's just like a page that's like, do you want to be a vet? Or do you like,
Yeah.
you can't just check boxes. I don't know.
It's
Yeah.
definitely not a reason that I decided to stop at a tech, but now that I have decided to stop at a tech, I've thought about that reason and it's very reassuring
Mhm.
to not have to worry about that as much.
Yeah.
Do you want to perform surgeries or not? That's another one too.
Mhm.
Right.
Yeah, to think about.
Yeah. I mean, because
Um,
you guys as technicians still talk to clients.
Yep.
Mhm.
So there's still a communication piece that still occurs. You are, I mean, and then there's additional communication pieces because you're communicating with your doctor that you're working with that day. You know what I
Mhm.
mean? I mean,
Yeah.
so I mean, all of that has to
Mhm.
happen. I mean,
Communication is going to be there no matter
Regardless.
what.
Yeah.
So
Mhm.
you have to work on your communication skills no matter which position you want.
you're going to work with clients no matter what.
Yep.
That's why I
Um,
think the real big difference is diagnosing and
yeah, the decision.
and then like things resting on your shoulder, like your
Yeah.
buck stops with you kind of
More
thing.
pressure.
Yeah.
Yeah.
I also think another helpful tip would be to intern or go job shadow
Oh,
at a
for
clinic
sure. Good idea.
and like job shadow, like ask if when you go there to shadow, if you can shadow with a vet and a technician.
Yeah.
So then you can see both sides and both aspects. Would
Yeah.
be really helpful.
Yes.
I think job shadows are ridiculously helpful.
Yeah.
Yeah.
I agree.
They're very good tools.
Yeah. So even getting in a clinic and either working or observing,
Yep.
Mhm. Yeah,
I think would be helpful.
for sure.
Tips.
Um,
What do you guys think? Just that.
I think we've
just
talked
get
about it before.
Exposure.
exposure,
Mhm.
yeah, and just ask a lot of questions and
Yeah.
wanting to get in. I mean, it's about who you know. I hate to say it, but a lot of it comes down to good
Yeah.
references and things like that too. So
Mhm. I also
Do you guys know anybody that went so at Purdue, because we're in Indiana, has gone to the tech program, so 4 years, right?
Uh-huh.
In the 4-year program, and then goes to vet school.
Nope.
Have you
No.
known anybody? Have you guys known anybody?
No,
who's
but
done that?
I have like thought about it. Not me. I mean, kind of me personally. Like, oh, like I wonder if after I get my degree, if in the future I decide to be a vet, if I can just do like vet school. But I don't know.
Well, you have prerequisites you'd have
Yeah.
to meet
Right,
or
yeah.
whatever. But I don't know
But I don't
anybody
know
either
anyone.
that's
I don't
gone through
think
the
I do
4-year
either.
program and then decided, okay, that's my bachelor's. Now I'm going to go to vet school.
my
I'm sure somebody's out there.
oh,
who's
I'm
done it.
sure. Yeah,
I
but
always
I don't
thought
know
I wanted to be a
anyone.
vet. Like I always knew I wanted to work with animals. I was like, I'm going to be a vet. And then I started interning at All Star during high school. And I was like, nope, I'm going to go be a tech.
Mhm.
So that's
Yeah,
why
I
like
think
the exposure was
That's
so
what I was going
helpful.
to say. I think once you're exposed to the difference between the two positions,
yeah.
I think it becomes very obvious.
It's
Yeah.
very
Yes.
significant. The
yes,
differences.
agreed.
Where it's like, oh yeah, I could see myself doing that.
Yeah.
Oh hell no.
Mhm.
My
I don't want
parents
to do any part of that.
Yeah,
You
for
know.
a year after I graduated college, my parents like, you're gonna go back to school to be a vet. I was like, no, I'm not.
Right.
I like being a tech. I love
Yeah.
my job. I do not want to be a vet.
Yeah.
Yeah.
That's just
Just
not my cup of
different.
tea.
Yeah.
And that's okay.
Just different. All right, number 2. Who wants to go? Courtney, you go.
Alrighty. Hello, I work at a private practice, and it is the only hospital I've ever worked with. There are a few meds/sups I thought were common because they are amazing, but other people in vet med haven't used, like Mayo's muscle powder and Yuyan Bio. I was wondering if you guys use Clever
Yeah.
for dogs and what you used for cats to induce emesis. From Morgan Harris.
I looked up Mayo's muscle powder because I wasn't familiar with it.
I've never heard of
There
it.
was a study done, I don't remember the year, that it had that versus a placebo for dogs after TPLOs to see if it helped prevent muscle wasting.
Oh.
And it did.
Huh. Fun.
Yeah.
Cool.
So I thought that was interesting. So maybe I will bring it up now, especially dogs in recovery.
Yeah.
And now that we're doing TPLOs.
Mhm.
And we were talking before this, we like Union Bio. We used it a lot at Purdue as well. So it helps with bleeding and stop bleeding.
Stop bleeding. Stop.
I think it's a
bleeding.
great drug.
Yeah. I think the thing with supplements, there's just so many.
Yeah.
Mhm.
And it's hard to know because they're not a drug. So then they're not governed the same way in terms of what's required of them to be
Mhm.
manufactured and be distributed. Then you get into like the origins of the products that make up
Yeah.
the supplements,
Mhm.
or the ingredients that make up the supplement. There's so many things that go into it.
Yeah.
And I think that if the companies are willing to list like the origin of their ingredients, if they're willing to say, are they making the product and are they distributing it? Or are they just distributing someone else's product?
Yeah.
Are they like, there's so many things. And I think if they are transparent with that, then I think you can start to trust. Do they do studies? Do they do safety studies? Are the things that happen just inside their own building, or do they have people outside that are doing
Sure.
Yeah.
Right.
and I think some of them are and some of them don't. But
Yeah.
it's like, how do you know? I mean,
There's so many supplements.
we do have
yeah.
that list of, it's the organization, the NASC. It's like the supplement.
Oh, I
thing.
didn't know about the list.
It's like a list of that have been like, oh gosh, I can't think of the word. Not recommended, not approved. It's like basically that this organization says
Vouched
Yeah,
for?
vouched for.
Okay.
Basically.
Okay.
While you're talking, I will look it up. I can't
Okay.
think of it. I'm gonna look it up right now.
I've never used Clever for dogs. What is that? I didn't think
we tried using Clever at the clinic, and McDivitt's used it. It's to induce vomiting.
Oh, is that the eye drops?
eye drop.
Oh,
Oh.
that's
We
the
didn't
eye
like
drop.
it.
Oh.
I do not like the eye drop.
I think
Okay,
it's
I didn't know that's what it was called.
Mostly because we're really impatient, and so then
Yeah.
we've used
Apomorphine.
Yep.
Uh-huh.
We prefer apomorphine. The
Yeah.
one time I used the eye drops was in a coworker's dog, and he got like nauseous, I guess, but it took 30 minutes if that to take effect, and then
Mhm.
he was so nauseous after, like even with Serenia on board, he still looked like crap.
Oh.
And like Apple, I feel like Serenia
It lasted longer.
handles
Yeah.
it pretty well, and yeah, it just takes a lot longer to make him vomit.
Mhm.
And so I don't know, I don't prefer it. I prefer Apple,
Yeah.
and you also want to get the stuff up quickly, typically
Yeah.
most of
Yeah.
the time. So
Yeah, I don't plan on using it ever.
No.
Probably why I didn't know the name.
yeah, I didn't know what it was called, but we have them.
Yeah. So used for cat emesis. Well, we kind of talked about that another time, but you can use some sedation like Dex. A coworker of ours has tried to take the cat and sit in the lap of one of the technicians and spin in the chair
Mhm.
and literally do that as
I
well.
think you give it drugs first and then do
Yeah,
that.
yeah.
Mhm.
We had the listener say cephalexin,
Yeah.
Yes.
Yeah.
right?
Well, cefazolin.
Yeah.
Cephazolin.
Yeah.
Yeah.
Cefazolin.
Yes. Yeah, but that's when we went down.
Cefazolin, do a bolus IV.
Yes.
Um,
Other than I can't tell you the last time I tried to induce vomiting on a cat.
Yeah.
otherwise, we just try to get it out of the scope if it's in the stomach, and if it's foreign body, I should say.
Yeah.
Right.
I have not made a cat or
No.
tried to induce vomiting on a cat in a very long time.
Have we ever had success that you know of?
I don't think the one time they just did it with circling in the chair it worked.
It did not.
It did not
They
work.
still had the scope.
Cats don't like to vomit on command, but they like to
Nope.
vomit at 4 a.m. in the morning. They'll give it oral medication.
Hairball.
Yeah.
Too many temptation treats.
Yes. Do you have some info over there for us?
I'm NASC, National Animal Supplement Council, and they have a list of all of the companies that
Oh,
Nice.
I didn't know that.
are preferred suppliers or pre-qualified companies that supply products and services. So
NASC. Got it. I know a lot. I mean, the most common supplement I talk about on a daily basis is joint supplements. And I always recommend Cosequin, Dasequin, or Ficox Max, I guess. And yeah, I mean, the Cosequin and the Dasequin were, I think, just from hearing from our the orthopedic surgeon colleagues saying that's what they recommend. And when they're in that all the time and watching that, that's why I'm like, okay, they're credible. Yeah. So, and I know people, they're fairly inexpensive and get them online, treat form.
Pet stores.
Exactly. So,
okay. All right. I think we answered that pretty well.
Yep.
And now let's hear a word from our sponsor.
Looking to protect your canine patients against parasites? Look no further than Simparica Trio, Serolaner, Moxidectin, and Pyrantel chewable tablets. The first chewable to offer triple protection from heartworm disease, ticks and fleas, and roundworms and hookworms. It's also FDA approved to block infections that may cause Lyme disease by killing deer ticks.
Use with caution in dogs with a history of seizures. Serolaner belongs to the isoxazoline class, which has been associated with neurologic adverse reactions. The most common side effects were vomiting and diarrhea.
Visit SimparicaTrioDVM.com for full prescribing information.
Case collections. Whoa.
Yep. Popcorn it. Just like in middle school.
Popcorn.
All right, Devin, start us off.
Okay. Case collection inquiry. Hi, I always watch y'all's videos and love the Veterinary Roundtable podcast. We have an interesting vet med case of one of our dogs who's from Iraq, and it's one of those things that might be interesting to talk about on the podcast or educate people on, because if we wouldn't have done any further investigation into what was going on, we may have ended up euthanizing to avoid what we thought would end up as a splenic tumor rupture. So here goes. We have 2 dogs from Iraq that my boyfriend brought home from deployment, and both dogs are about 6 years old. They've been with us in the U.S. for almost 6 years now. Last year, our male dog became lethargic, didn't want to eat much, would throw up, have diarrhea, etc., and his stomach was distended and felt like a mass or something was in there. This kept happening on and off for a couple of weeks, but he was otherwise fine. I'll continue in another message.
Popcorn. We took him to the vet for his diarrhea, and she felt something in his abdomen, so they did an x-ray of his abdomen and chest. They found what they believed to be a splenic tumor that had spread into his chest. I was told that he could very quickly die if it ruptured, and that we should get him into the specialist, which we did. For a few weeks, we thought he could die any day, and we had the tough talk about if we should euthanize so he doesn't suffer. Fast forward to the cancer specialist, and they found out that it wasn't a tumor of any kind, but he had hundreds of cysts all over his body internally. They were in his chest, all over his abdomen, and full of fluid. His blood work was perfect, and they sent the fluid from the cysts off to be tested, where it came back as a kind of coccus. Did I say that right?
Yeah.
Okay, great. Caused by a tapeworm, and we all think he contracted it in Iraq as a street puppy. So with 2 different worming medicines, one every day, he is thankfully getting so much better. Go ahead, Keeling.
He's on Verbantal monthly and albendazole daily. He gets routine blood work to keep an eye on things because of the albendazole, but he's doing great. So my advice to anyone who has a dog that has been throwing up, has diarrhea, pants a lot, sometimes loses appetite, has what looks like a mass in the abdomen/spleen area, etc., is to definitely get an ultrasound to double check that it's not something weird like what our little guy has.
All the local vets here in Central Florida are amazed by it because it looks so much like cancer. It's made us all wonder how many dogs may have something similar but diagnosed with the tumor. Some vets here are using his case as a learning tool / case study, and thought I'd share since y'all always highlight interesting cases. Keep doing what y'all do. Jessica Lee.
Thanks, Jessica.
I would like to say something real quick for Jessica. I would love to see his x-rays.
Yeah.
Just to see.
Yeah.
Like, if you could send us those somehow. Okay.
Oh.
I am
She said she
I would
would.
love to see those.
Yeah.
Okay, great. So it sounds like we're getting them. Okay.
That
So I
is
think
really-
we should talk about the parasite first.
Let's do it. Do you have it pulled? You want me to pull? You want me to talk?
We can tag team it here.
Okay.
I will start by saying all those who just heard that case, don't freak out. This is not a not a
Especially
common,
in the United States.
especially in the United States. Please don't freak out.
It's just, it's not very common. And coming from Iraq, I mean, the Middle East is a place that it's known for being.
Yep.
So,
They
I'm going to say what it is.
Yeah, go for it.
Echinococcus is a parasitic zoonotic disease that has worldwide distribution. It has been listed by the World Health Organization as one of the 17 neglected tropical diseases that is targeted for eradication by 2050. Echinococcus occurs more often in the dog than the cat. It is a tapeworm. And then there's 2 species of main importance, granulosus and multicularis.
Yep. They basically ingest the eggs, right? So that's very, very similar to most of our parasites. Fecal oral,
from
yeah.
like the environment
it's
or whatnot.
interesting. It
Yep.
took 6 years to come to fruition.
Well, think about the gravity in which it got to, though. So, like, if there are cysts all over this dog's body, it probably, I mean, I just imagine, like, it's not going to happen overnight.
No, it's going to take a period of
Yeah.
time. Yeah.
Yeah.
And I mean, the dog is the definitive host in the domestic life cycle, it says. And then dogs become infected via ingestion of the cysts in intermediate hosts.
Okay.
So
So
he-
he ingest the intermediate host.
So do we know if he actually got it when he was in Iraq or not?
Oh, I'm sure that's
Or
where
he
got
for
it.
sure got
Yeah.
it from? Okay,
Yeah.
I was just curious
Yeah.
because 6 years is a long time. But
So
Yeah.
yeah, then the cysts develop into adult tapeworms in the small intestine. Millions of eggs can be passed in the feces.
And
Okay.
it sounds like he'll have to be on those medications for the rest of his life. Like not for just a short-term thing.
I don't know, I guess. I'm not quite sure how they would. I guess they would probably, in my mind, monitor the imaging and everything since his blood work was normal and these cysts are secondary to this parasite. They're probably going to monitor for those to go away.
yeah, she also said they do routine lab work to keep an eye on things because of the albendazole.
Yeah.
But
So
yeah,
watching liver and stuff.
yeah,
Yeah, that makes sense.
Risk factors include roaming outside, infrequent, more than every 4 months treatment with praziquantel, ingestion of intermediate hosts, and eating of raw viscera. So don't let your dogs out there eating.
Ew, that's not
Eating what?
raw viscera.
Like
Abdomen
roadkill,
contents.
probably, right?
Yeah.
It's also
Oh, yeah.
Iraq.
I mean, yeah. Not
And this
good.
said too, so the diagnosis, because of their low number of body segments, so tapeworms consist of multiple body segments, it's extremely unlikely for those body segments to be observed grossly. So a lot of times we find them on the butt,
Right.
and everyone's like, these rice-like things are moving in poop or around my animal's butt.
Uh-huh.
So it's very unlikely to see that, which is also probably another reason why. Yeah.
They also said lifelong therapy is required.
Huh.
Okay.
Yikes, that's intense. Just for
Yeah.
a
How
parasite.
common is it? Did you ever say?
Its prevalence is really low, actually.
That's scary though. I'm glad that the owners didn't.
Yeah, thank you
Not
for
s-
fighting for him.
Well, yeah, that's what I'm saying. Not saying some owners just can't afford to go to the specialist, and then they get stuck in that boat of, okay, I don't want my dog to be absolutely miserable, and if it has cancer, it's dying, and then they just euthanize. So
Well,
good for the owners
hands
for
down, the
fighting.
more common.
Well, yeah.
diagnosis- I mean, you know what I mean?
No,
Like, so,
100%.
yeah.
I'm just saying they kept going.
They kept
and-
looking, yeah.
So good
And
for you guys.
she said do an
Yeah.
ultrasound. So that's also another thing where typically, I mean, you
going
have to
through-
do that
right.
to identify
No,
if there's
yeah.
a splenic
sure.
tumor. And
Right.
but it's interesting that the vets in Florida, it looked like I'm so curious to see
the
Yeah.
X-rays, yeah.
because I did have actually, that reminds me. Do you remember that case? It was a 2-year-old doodle, and she, long story short, had lymphoma all over her body. And we finally found it because it was now taking over her eye. But
2 years
yeah.
old?
yeah, 2 years old. And with permission of the owner, we got samples after unfortunately we had to euthanize her, but it was everywhere.
I remember that.
I
Yeah.
remember this case.
Yes.
Actually, now that you're talking about
Yes.
it.
And it was one of those things where literally I remember looking at King, I'm like, okay, infectious wise, what do I need to be worried about? Because just like this, there are diseases that can cause what's called granulomas. So basically things that may look like tumors. So it's just a ball of infection or inflammatory tissue is how you could go about saying granuloma.
Right.
But that's when you see it on x-ray too, you have to have that on your list of possible causes. So anyway, so I can see actually how that would be very similar looking.
Oh, yeah. It's very interesting.
But then you take the case into hand, right? So you're you look at the dog's breed, their age, their history, things like that. Obviously, this dog being from Iraq is something to take note of.
Right.
And anytime we have an animal coming from the outside, we're always like, okay, what are the weird
What
things
are the
that you
other
bring?
weird things? Yeah.
Be prepared.
Yeah,
So,
for sure.
For show.
Yeah.
I'm really happy though you guys found that and didn't
Yeah.
have to euthanize, and he's still kicking
Aw.
it. That's really
Yeah.
exciting.
He is
Yeah,
very
that's
happy
very
for
cool.
your kiddo.
and a very cool case.
Yes.
Yeah,
Thank you for
sure.
sharing.
Yes.
Fascinating.
Okay, on to the listener question.
Listener question. Sure, go for it, Duckwall.
Okay. Do veterinarians dread when aggressive pets visit the clinic? What precautions do you take? Ryan Werner.
Great question.
That's a great question.
Okay, I'm gonna say something. I was Dr. Duck and I were kind of talking about this a little bit yesterday, and then we stopped ourselves.
Yeah, we're like, we have to save it for the podcast.
Yes. But it's not that I get excited for aggressive patients. I was kind of going on I like when we see a dog and it is aggressive or it's fear aggressive or something, and then we work with it for a certain amount of time and then we gain its trust. So I don't dislike aggressive dogs.
Mhm.
I prefer an aggressive dog over an aggressive cat, but I like dealing with the scared and I think it's fun and
Takes-
rewarding.
Yeah, it just takes a lot
Yeah,
of time and
absolutely.
patience. So I think where I get stressed by it is if it's a patient we don't know, we've never met,
Yeah.
but there are precautions coming in from other records or from the owner. If they're like, warning,
Mm-hmm.
I get uneasy about that because I like to be prepared.
Yes.
And so the ones that we know have certain triggers or act a certain way, I'm not worried about it because I
Right.
know we know how to handle them. We know their medications they need, things like that. It's the ones I don't know. Or if I've had some where they are doing great, but that's a bad day for whatever reason. And that kind of always takes me back or makes me step back because I'm like,
Yeah.
wait, this is not this is not the relationship we have. What
Yeah.
is going on?
Yeah.
Yeah.
Yeah. Well, Dr. King made a short video on this a couple weeks ago on her Instagram. But she had a good point that it kind of revolves around the owner as well. So like if the owner is aware of their pet's temperament and they are like helpful with us and like on board with our protocol, like they know what works and they're helpful, it makes it a lot better of an experience. But the owners that kind of just like dismiss their pet's aggression or triggers or whatever, that's when it gets a little dicey.
It gets stressful for all parties because you don't want to upset anyone, but then you
don't
want
want
to
to get
be
hurt.
safe.
Yeah.
Exactly. Yeah.
And we do take a lot of precautions. Like I'm sure every vet clinic has a system of putting pop-ups in. So in patients that do have triggers, we say what worked well, what didn't work well. And then we can kind of look at those when they're coming in again and go off of that and make it a lot better of an experience.
Yeah. I think that the medications, I mean, like coming up with not just hog tying dogs anymore or cats, to get treatments done. I think there are some people still have the mindset that you just get it done. It's like, but that's not always,
It's not worth it.
No.
patient safety and staff
Stress
safety are the
and-
big
yeah.
things that we try and keep at the forefront of our thinking when we're trying to decide how far do we push the animal,
yeah.
So I mean, I there is a balancing act there. So the precautions I think we take are drug therapies, some behavior modification, different kinds of handling and trying different things.
Yeah, we have a
to
sling.
try-
a lot of
We
tools.
have
Yeah.
e-collars,
Yeah.
towels,
Muzzles.
muzzles.
Lots of treats.
I think if you
Lots of
once you
treats.
start working with the patient, they're very predictable typically.
Mhm.
Like once you know them,
Yes.
to your point, Duckwall, like they're very predictable. Those don't stress us out 'cause it's like you already know what you're
Yeah.
getting into.
Yeah.
But like I do dread. I'm not going to sit here and lie and be like I don't dread these patients coming in. I dread the ones coming in where I'm like I'm going to have to convince the owner that the animal's actually aggressive. Like that is like
Yeah.
really like I'm going to have to look here. Do you want to hold them?
Yeah.
So you can see that they don't like us doing what we're doing, or are we just going to forego? Are we doing a visual inspection today? Like forego putting our hands on the animal because we don't believe in sedating them or giving them medication prior to the visit, but yet we can't handle them. So what are we doing? I think that's where a lot of the frustration
I agree.
comes from because it's like I can't do my job,
Right.
but yet then I have somebody mad at me because I'm not doing my job. But yeah, I can't do my job.
But you still have to also protect the owner.
Yeah.
And you can't
It's a
get
lot,
them. No, that's a great
it's-
example.
Yeah, it's like Devin was saying, then you upset the client
Yeah.
or they get embarrassed and then they get defensive and then
And on the flip side of that, I feel like you especially have a lot of clients where like you have difficult patients and you take the time and you gain their trust and they are like, they don't need as much drug or sedation or anything for their visits, and the owners really appreciate you taking that time. So there are some that
It's
are
a
like
process
that as well.
to get to that spot.
Duckwall and I have a pity She's 2 years. We have had her for 2 years, 3 years.
3, yeah.
She's been our patient for 3 years, and she used to come in, not saying anything against pit bulls. Don't take my words and twist them. She used to come in like for annuals. We'd have to fully sedate her, and it would be like a walk and poke, like IM sedation. Couldn't go anywhere near her pretty much. She was just so scared, and she took it out with aggression. And now she comes in, I think, on trazodone most of the time, and we put her in the sling, and you can do anything you want to her. And she wags her tail, and she eats treats, and it is just the most rewarding thing. And like, I did happy visits with a dog for 2.5 years, and I finally got to the point where I could take the muzzle off the dog and pet her. And like, it's just so rewarding.
I think those are really, that's
it
when
is
you get
just
excited,
so,
It really
you
is.
know, about, okay, this stuff works.
You
but
see
it's
the
just-
trust in both parties.
it's just so cool.
Yeah,
It's like one of my favorite things. I love it.
Yeah.
for sure.
And I think honestly, like having an understanding from both parties, meaning our side on the medical side and the owner, of what's the expectation for the visit. So they know whether the owner knows the animal's triggers or not. We've had some new clients come in and, you know, knowing the animals, they're wary. And so I've literally taken 45 minutes to an hour to just sit in the exam room and like start to build the trust of the owner and the dog, and like visual. Yeah, I could touch it. Maybe I couldn't listen to the heart with the stethoscope yet. But after that time, I'm like, okay, I'm actually very pleased with this approach. Are you okay with that? Are we okay with saying, let's stop here now, let's do this visual exam, and then, you know, come back another time for the shots and handling, and that's okay too. Like, obviously you don't want to create an inconvenience, but it's kind of like meeting in the middle of like, what's your expectation? What's my expectation? Are you okay if we're not maybe going full throttle today?
Yeah.
A lot of times they're like, what precautions? Well, I honestly sometimes will just ask, do you think your pet is protective of you? If your pet is protective of you, I'm getting these signals. Like, are you okay with me having my nurse handle the animal for me away from you? Or some animals do better with the owners. Like, but I think I've learned to ask that question because I had an instance where a dog was super friendly, super nice, routine visit. I'd seen this dog before. I bring out the peanut butter, and I guess I hadn't done that before. I don't really remember. And the dog was extremely food aggressive, and I wasn't aware of it. And I actually got nipped in the face on the nose. And honestly, scariest moment of my career. One of the scariest moments of my career, because it was nicely a warning nip, and it was a large dog. But then I come to find out that's happens all the time at home. And so now I'm like, okay, I'm going to start asking these questions of like, is the animal food aggressive? No big deal if they are. I'm just not going to get out the peanut butter, you know, things like that. And just, communication is key.
Communication is key. Absolutely. Oh my gosh.
Yeah. Do you prefer aggressive dogs or aggressive cats?
Ooh.
I know my answer.
Aggressive dogs.
What about you?
I would say probably aggressive dogs. Unless it's extra large. The St. Bernard that I'm scared of, that one I would take aggressive cat over.
Yeah, I would agree.
Day.
The size of the animal does make a difference.
Yeah. I think generally I would say cats. I don't know.
Yeah.
Your cat, baby. I wouldn't it's not funny by any means, but sometimes it's not enjoyable either. But honestly, sometimes I just I like not manhandling these cats, but like after like a big scene of like fur flying and like someone with the cat gloves on and the cat muzzle and towel and this and that, sometimes it can kind of be comical. It doesn't make me happy, but I'm like, and then we're like, wow, like that just happened.
Yeah.
Sounds like those cats need Bond Cat.
Right? Exactly. Like, here's our advertisement for Bond Cat. No, I think that they go from 0 to 100.
Yeah.
Like the way
with no warning.
Now, I love cats, working on cats, because they are very predictable. Like if I can put my hands on a cat, you can put your hands on a cat.
Yeah.
You can do what you need to do with that cat typically. You know, you're not going to get surprised. If you can't, you can't. They're on the ceiling. Like, so there's no, like, I never felt like
they're just
that you can't, like, I just know what I'm getting into.
Yeah.
And a dog, sometimes I can tell. And the majority of the time I can tell, but then sometimes they trick you.
Yeah.
You know, and so it's like very interesting. Like, so I feel better when I'm working with cats if in terms of behavior,
Yeah.
because it's very easy. It's like you can touch them, you're fine.
Mhm.
Okay, fine. If you can't, you can't. Yeah.
See, I agree with that, but at the same time, every once in a while, she'll come out of her room and be like, "That was great. I did my whole exam. It's ready for you to draw blood.
Yep.
It's so good." And then I take it to the cat room and it damn near kills me. Like,
Right.
Yep.
Yeah.
That happens.
so then
That's
there's
true.
that aspect of like kitty minutes
Oh,
too.
yeah.
grew up with
So-
spicy cats versus dogs, so like I have a lot more exposure to spicy cats and like how
Yeah.
to handle them. I'm a lot more brave
Mhm.
in handling them than dogs, but I would choose cats.
I'm just
Yeah.
curious on everyone's opinion.
That's
Yeah.
a very good question.
Mm-hmm.
Would you rather have a spicy horse or? I'm just kidding.
No.
a
Definitely
spicy
not.
cat.
Oh.
Not a spicy
A horse could kill
Hell
me.
No.
So
Yeah.
could a
Yeah.
dog.
You said cat.
He did say cat.
Oh, well, cat could too.
I would-
Take your
I
finger.
would choose a cat.
You
too.
can
Look
get
at
cat bite, whatever, or what is it called?
Cat scratch feet.
Yeah, that could kill you, I
would
guess.
choose cat scratch
Yeah.
or not cat scratch, but cats over horses.
You would?
Aggression wise, yeah. Because even like
Can you drug both of them?
Can you drug
Yeah.
both of them? Yes, there are drugs available.
That's what I'm saying. So just
Mm.
drug them.
That's what it really comes down to. You need
Make
proper
the experience
preparation.
a good experience.
horses,
That's right.
like they can do so much damage. I'm not saying cats
Oh,
can't
yeah.
do damage,
Yeah.
but
I almost
so much
lost my
damage.
pinky
From a needle.
from a cat.
Self-inflicted. No, not really.
Okay,
Uh,
we did it. Thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. We'll see you next week for another episode of the Veterinary Roundtable.
Bye-bye.
Bye-bye.